All right, guys, I'm going to go ahead and get started. Today, we're going to be doing some training on MedMutual. And MedMutual is actually becoming one of my favorite options. Um, Anytime a new product comes out in the market, I always sit on the sidelines for, 6 months or a year or so. Mainly because since the ACA has become the law of the land, we've seen so many come and go. Um, so MedMutual has been out now for about a year and maybe a little less, maybe 8 or 9 months or so. I got contracted with them about 90 days ago. And you know how that goes, right? You get contracted, and then another month goes by, you do a training. Another month goes by, you start playing with the quoting platform. And then you start to really dive into the products and learn how it operates. And I got to tell you guys, I love the product. I think there is a very, um, I think it's a very strong play. So let's dive into it, and you guys can make your own decision. But what is MedMutual? MedMutual is basically a an indemnity plan, just like Manhattan Life or like Philadelphia American. MedMutual is an indemnity plan, but it sets itself apart because it has some catastrophic plans that can sit on top of it. Anytime you insure a client with an indemnity plan, the gap that you are not filling is the catastrophic, right? Because the main problem with indemnity plans is they do not have an out of pocket maximum. Okay. They're going to provide a certain level of benefits, right? For whether it's a doctor's visit or diagnostic testing or hospitalization, they give you a set benefit amount, right? And then if the bill comes in over and above that, then that becomes the insured's financial responsibility, right? That's how indemnity plans work. So you can have a great indemnity plan with $1 million calendar year maximum, and your client gets a $500,000 bill, and let's say the indemnity plan does everything it's supposed to do. It it you get the in-network discount, the repricing, and the $500,000 bill gets knocked down to 250,000. And then let's say the indemnity plan provides you know $200,000 worth of benefits. Well, your client's still left with a $50,000 bill, right, to come up with out of pocket. Now, in most cases, you're going to be able to you'd be able to negotiate that down, or that's what the advocacy service is for, right? We'd negotiate that down, but it still leaves your client vulnerable, and it may give them a headache that you don't want to give them. So these indemnity carriers have come up with these catastrophic plans that will sit on top of the indemnity plans. All right, and they will pick up the tab once they reach a certain once they reach a certain level of in bills, right? And usually those catastrophic plans come with higher deductibles, 25,000, 50,000, 100,000. Okay, those are going to be the catastrophic plans that are available with Philadelphia American and Manhattan. The thing that I love about MedMutual is the catastrophic plans are available with $5,000 deductibles. All right. So now you can have a couple of catastrophic plans with $5,000 deductibles, and then an indemnity plan that covers up the lion's share of that first 5,000 and even continues to pay well beyond 5,000 in bills. All right. So it's a really nice bundle of coverage. So when you first log in to MedMutual, this is going to be your dashboard. This is where you start. Okay. And you're going to click on MMPE app. All right. This is where you're going to go to quote and find the products. Okay. And you'll see here, I've only got a couple names in there. I've only got one client in there so far. So this is, again, brand new to me. But, I've been quoting it more and more the last couple of weeks, and I've been presenting it more and more the last couple of weeks. I've got a lot of pending business that I'm going to start to put through this. So you'll go to MMPE app, all right, start a new application. And this is going to require a little bit more information than most when you're running your first quote. It's going to ask about lead source. You got a lot of different options here. Usually I just, choose whatever, friend, referral, zip code, just like any other. I will go ahead and put my information in. Effective date. The effective date is always going to default 7 days out. All right. Date of birth of the primary, gender of the primary, and then it's also going to ask for email address. All right. So go ahead and plug in the email address. And then it's going to ask, does this applicant use tobacco products? No. Okay. Here's where you would enter in spouse and dependents. You can add more dependents down here. Okay. We'll remove that dependent, and just for time purposes, we'll call this a single application. All right. And to that point, guys, I want you to know, because we're obviously throwing a ton of new products at you. When is this going to be the make the most sense, right? Maybe I can draw up kind of a cheat sheet for you guys that you can work off of. But MedMutual is going to be very competitive for anybody who is a single applicant and under the age of 50. Okay. Once you start getting to about 50 years old, there's going to be some other products that look a little bit more intriguing. That's going to be LifeX and Iron Health, right? 50 years and above for a single applicant. But under 50 and as a single applicant, MedMutual is going to be very attractive. And then a family right around middle age and under, right? So late 30s and under, maybe even very early 40s and under, right? I just did a family of five. I quoted a family of five the other day. I think the primary applicant was right around my age, a little couple years younger, so call it 41 or 42. And his wife, same thing, and they had three kids, so a family of five. And I quoted them on MedMutual, and it was about $1,000 a month, and which was the same cost for a family that age. Um, for a LifeX plan. Okay. The LifeX plan for the family of five with an applicant at that age was also about $1,000 a month. So they went with the LifeX plan. The LifeX is going to be more traditional, right? It's going to be, your deductibles, your copays. It's what people are used to seeing when they're buying health insurance, right? When you get into these indemnity plans, you really have to take the time and slow the customer down and explain it to them. And what I found is when your clients understand how these plans work, they love them. All right. But if you just, these agents that gunsling these policies at people, and people don't know how they work, and they think they're buying traditional health insurance, that's almost inevitably going to be 100% of the time, it's inevitably going to be, a chargeback, or they're not going to be on the policy very long. You may get them past the 6 months to clear out the advance, but they're not going to be on the books very long. All right. So anyway, under 50 for an individual, and family at about 40 and under. All right. MedMutual is going to be a very strong play. All right. So we've got a single individual here, 46-year-old male. So we're going to run with MedMutual. Okay. I agree to work electronically. I mean, isn't that how insurance works today? Are there any carriers these days that are still doing stuff on paper, face to face? I think that's totally dead, right? I think the last of them are gone. All right. So as you can see, there's several plan options here. The three policies we're going to focus on are going to be the specified disease, the accident insurance, and the hospital indemnity plus. Okay. Those are the three policies that, when bundled together, are going to create that real rock star package of health insurance that I was just explaining to you guys. Okay. So let's dive into those three. All right. Depending on you got dental and vision. The dental plan is not that strong. The dental plan only goes up to 1,500 annual maximum. All right. So if you guys are going with dental, stick to that Allstate dental. All right. The Allstate dental is still going to be the best game in town. Okay, so the tabs are up on the top here. You've got specified disease, accident, and hospital. All right. It's going to give you a few different variations of the policy. All right. So first, let's look at the policy and what's covered. All right. So specified disease. Okay. Specified disease is going to be coverage for all of these illnesses. Okay. There's 20 illnesses here. Okay. Any of these illnesses, also um, any illness that can fall into one of these categories. Okay, for for instance, if you say, say here we've got gastrointestinal disease, right? There can be several things that fall into gastrointestinal disease, like diverticulitis, um, Crohn's, right? Could be gastrointestinal disease. So anything that falls into one of these 20 categories as an illness is going to be covered by the specified disease plan. All right. And I went through this. I even used AI. I even asked AI, like, name a few illnesses outside of these categories, um, that could exist. And there were a few. I can't even name them right now. There were a few, but even AI was only able to give me a few examples. All right, so most of the big things, right? Cancer, diabetes, heart attack, stroke, pneumonia. Actually, COVID was one of the examples that the AI gave me. Actually, it's not, because COVID's right there. I can't think. I can't even think of one. I can't even think of one example that the AI gave me that didn't fall into one of these categories. But there were a few. But the point is, there's a lot of illnesses that will fall into these categories. All right. And so this specified disease, and remember, the specified disease plan is just going to be the catastrophic rider. Okay. So let's pull up the brochure here real quick. Well, actually, I don't even have to, because the other thing I wanted to show you was the wellness benefit. Okay. So um, it's going to cover benefits for any of these diseases, all right? But it also has a $200 wellness benefit per calendar year built in as well, all right? And so the different variations of this policy is you can see here you've got a $5,000 deductible, 100% coinsurance, and a max benefit of $1 million. Okay. So if you have any of those diseases, once you get $5,000 in claims, once you hit $5,000 in bills, you're covered 100% up to $1 million. All right. Again, the other specified disease plans that are on the market are going to have deductibles of minimum 25,000. All right. Um, Most of the time, you're going to be selling that a specified disease plan with a deductible of 50,000 or 100,000. All right, for pricing reasons. Okay. There is not a specified disease plan with a $5,000 deductible, um, that's going to be cheaper than this. Okay. So that's the plan I like to sell, but you've got some other options available here. $1,000 deductible, 50/50 co-insurance to a max benefit of $1 million. All right. And there's an out-of-pocket maximum, which is still pretty good, right? So you understand how that works. You've got $1,000 deductible, and then you're splitting the bills 50/50 with the insurance company up to a maximum out of pocket of 15,000. All right. So whenever I was training new agents, I would always quiz them on deductible and co-insurance and how plans worked. And so I'd say, okay, taking this into, take with this formula here, what is the amount in bills that a client needs to rack up before they're covered 100%? All right. And I won't make you guys think about that, but I think it is what it's thousand the first $1,000 and then 50-50 to the next 14,000. So 29,000 in bills, right? So after 29,000 in bills, you're covered 100%, right? And out of that 29,000, the insurance company is going to pick up 14,000 of it, right?
Can I ask a
Um,
quick question?
sure.
So in what I figure it out compared to ACA plans and any of the private plans, the example you gave, like $1,000 deductible and 15,000. I think my understanding, like let's say once you 1,000 deductible is paid and then 50-50, I think we have to pay 15,000 compared to like 14,000. Like the example you said is correct in the ACA plans, but in any private plans, I think deductible is not part of the out of pocket. Is that right, or it depend upon the plan?
Yeah, I know what you're asking, but I don't think that's accurate. I think the
Okay.
entire out of pocket maximum's 15,000. I could check. You could be
Okay.
right, but I don't believe you're right. But you could be,
Maybe,
right?
maybe is the
I,
answer. Yeah.
I, I know what you're asking. I'll shoot you an email on that.
Sure.
Um, all right. So, but again, keep in mind that this policy specifically here, this specified disease policy is just one piece of the coverage that we're building, right? And so you've got a couple other different variations of the policy here. You can go with a zero deductible, 100% coverage, but the max benefit's only 10,000. You got another zero deductible, 100% coverage, the max benefit's only 25,000, right? And on and on, right? So a couple different options. I like the 5K deductible with 100% coverage up to a million. Because again, the reason I'm including this policy is for the catastrophic. Remember, the whole gap I'm trying to fill is that catastrophic piece of the coverage on the indemnity plan. So let's select this, and then we're going to move over to the accident piece of the coverage. Come on, computer. We don't have time for this. All right, I'm gonna let that spin for a minute. I apologize. The accident piece of the policy is going to work the exact same way. Okay. I'm going to choose the exact same coverage variation, a $5,000 deductible with 100% coverage. We're sorry. All right. Sorry about this, guys. We'll have to go back in. All right. You get to see the quote a couple times. Email. All right. Picking our three plans again: specified disease, accident, and hospital indemnity. We're going with the 5K deductible, 100% coverage up to a million on the specified disease. We're going to do the same thing on the accident, the 5K deductible, 100% co-insurance up to a million. And that's going to cover any accident or injury. Okay. Very straightforward. And again, you guys see there's other options here. You know, you can go with a $2,500 deductible and then 80/20 all the way through up to a million. All right. So no max out of pocket on that. Um, what, 80% of a 1,000,000, 200 grand. So you guys can see there's a couple different options here. No deductible, 100% co-insurance up to 10,000. 500 deductible, 80/20 to up to $1 million. Again, no out-of-pocket maximum, and then 100% coverage up to 25,000. So again, my whole purpose for adding these policies is to get that catastrophic piece. All right. But now, even if I didn't include an indemnity plan, if I just sold the specified disease in the accident plan, I've got somebody covered after a $5,000 deductible for illnesses and anything that falls into those categories of those 20 illnesses, right? Plus, they get a wellness benefit of $200 every year, right? And any accident or injury above $5,000, they're covered up to $1 million. All right. So they've already got, I mean, for $175, they've already got pretty decent coverage. All right. But now I'm going to include an indemnity plan, which the indemnity plan is going to, um, provide a lot more benefits, right? And the purpose of adding this is to cover the lion's share of that first 5,000, right? But even once $5,000 is met, let's say, Mr. Jones has an accident or an injury, and that accident or injury is, $100,000 worth of bills. Okay. Once Mr. Jones hit 5,000 in bills, he's covered 100%, right? Because he's
એટલે
got
બધું
that
પવન કેમ છે?
he's covered 100% after 5,000, right? Up to $1 million. Guys, do me a favor and mute yourselves if you haven't already. Um, once 5,000 in bills is hit, the indemnity plan will continue to pay out. All right. So there are circumstances where clients can rake a lot of money. All right. So indemnity policy going to work the same way as the Manhattan indemnity or the Philadelphia American indemnity. All right. The one I like to go with, what I'm quoting is going to be this middle of the road here, this hospital indemnity plus, and that's just for pricing purposes. All right. If I like the price tag on the indemnity plus up here, I may do that, but let's go here and look at the details. All right. So you've got your per day benefit for hospitalization, 2,000 a day, ICUs, 1,000 a day. All right. Skilled nursing facility, 1,000 a day, mental health facility, 1,000 a day, short stay in the hospital, 1,000 a day. And you also have an admission benefit. So think about this, clients admitted into the hospital right off the bat, they have an admission benefit. Okay. So going back to that $100,000 bill for that accident or an injury, they've got that 5K deductible plan, but they've also got a $4,000 accident plan. And usually if you're hospitalized due to an accident or an injury, you're probably going to need a surgery, right? Your surgery benefits are right down here. Okay. These are going to pay the surgeon. You've got the assistant in surgery, the anesthesiologist in surgery, all getting benefits. Outpatient coverage, 150 a day for the doctors. There's no limit. Okay, they can go to 30 doctor visits a year. They're going to get that $150 benefit each time they go. All right. It's another reason I really like this policy is because, again, just comparing it to the other indemnity plans that are out there. Manhattan's got a 10 doctor visit limit annually. Philadelphia American has an 8 to 20 doctor visit limit, depending on which plan you go with. All right. This policy has no limits. All right. The the benefit for imaging, MRI, all right, CAT scans, $800. That's a great benefit. Guys, I work with the advocacy team at VCare. We find MRIs for clients for 300, 400, $500 all day long. So an $800 benefit is phenomenal. Okay. X-ray benefit, a little light on the X-ray benefit, but not bad. All right. Lab benefit. Okay. Annual female exams, $400 per exam. That's a fantastic benefit. All right. Colonoscopy benefit is excellent, $1,200. We find colonoscopies for clients for right about that price tag, $1,200, $1,300. So with this plan, that $1,200 benefit is going to cover it almost entirely, right? And then you've got some emergency benefits. Okay, the emergency room benefit, $1,000. That's fantastic. Okay, ambulance, $400 benefit for urgent care. You know, the average urgent care visit is like 150 to $200. So a $400 benefit to the urgent care with no limits. You can go to the urgent care 10 times. All right. So I really like this indemnity plan. Now, this is the top tier indemnity plan. I'll show you guys the benefit levels on the one that I like the most, which is the middle of the road here. And you can see how the benefit levels are just a dip lower, right? But again, keep in mind, they're getting unlimited doctor visits. They've got a great benefit for MRIs still. They've got a great benefit for the urgent care still. They've got a better benefit for the emergency room than any other indemnity plan out there. They're still getting per day. The colonoscopy benefit is still better than any other indemnity plan out there at the $900. So even with the the lower tier indemnity plan, the only benefit that is lower on these policies is the per day hospitalization. And that's because, when you're selling a Manhattan plan, you're selling 4,000 a day hospital, or you're selling a Philadelphia American plan and you're selling 4,000 a day in the hospital. Excuse me. You're going to need more hospitalization coverage to get to those catastrophic plans that have those deductibles of 25,000, 50,000, 100,000, right? We don't have to have those big, giant per day hospitalization benefits because we're getting to our $5,000 much quicker, right? All we have to rack up is 5,000 in bills to get into our catastrophic plans. All right. So I like this middle of the road. I'll show you guys one more here. The lower level. Which still, coupled with the catastrophic plans, it's still fairly decent coverage. All right, $50 a day to the doctors, $200 urgent care benefit, $500 for the emergency room. That $500 for the emergency room is still better than what you're going to get on any other competitive indemnity plan. All right, benefits for the surgeon, inpatient. All right. So I like to build my coverage like this. Okay. So I do my $5,000 deductible with my specified disease, my $5,000 deductible with my accident plan, and I slide the middle of the road indemnity plan in. And for this 46-year-old male, I'm looking at $333 a month. All right. $333 a month. That's before I ask if they want dental and vision, which again is sold like French fries, right, guys? Would you like dental with that? Would you like vision with that? 50% of the time they're going to say yes. All right. So this would be the quote that I'm going out with for that 46-year-old individual. All right. Because again, it might be a little less expensive with Manhattan or Philly, but the benefits are not going to be as strong. And for that 46-year-old individual, a LifeX plan is going to be about $500. All right. So I'm winning on price and coverage here with MedMutual. All right. Very, very strong portfolio. All right. So now, Mr. Jones wants to buy. Here we're going to take it to the application. Okay, so we continue. And if you want to email the quote, you'll click here and enter their name and email address in, and it's going to show up in their inbox just like this. Okay, this is exactly what it's going to look like in their inbox. Okay, and they'll be able to view the plan details. which look exactly the same as what I just went over with you guys. Okay. So we're going to go ahead and begin the application. Now you can choose either in person or on the phone. All right. I always choose in person. Okay. Because every time I'm doing a deal, I'm in this setting. I'm in person. I'm doing it on a Zoom call or they're sitting at my desk. Okay. And they have to agree to doing the application electronically. Okay. So now we're going to fill out the application. I'll just enter my information in. Go next. Height and weight. Very proud to say that I weighed in under 230 this week for the first time in years. And you'll go through all the health questions here. I'm not going to read them all to you guys line by line, but if any one of these is answered yes, then they're not eligible. All right. The underwriting is in the health insurance world considered simplified issue on this carrier. All right. If they answer no to all these questions, they're basically going to issue the policy. Okay. They're not going to do an extensive underwriting process up front. Okay. They're going to issue the policy. So it's pretty simplified issue. So you want to make sure that your clients are being truthful with you. All right. Because if they end up, having a heart attack 6 months in, then they're then the carrier is going to go ahead and they're going to do a little deeper dig at that point. All right. It's called underwriting at the time of claim. All right. And so just knowing that up front, just make sure that, you're selling this product to healthy people. All right. So next, you put their phone number in, cell phone, home address. Next, city. Okay. Read them all their stuff, which you guys are pros at doing, selling a lot of life insurance. This is a breeze for you. You got to review with them what they're buying now. Unlike a lot of carriers, when you buy multiple products, they itemize the bill, right? And agents don't like that, right? Because we have to explain. It takes a lot more explanation on our end, right? We don't like when we sell a $400 policy to a client and they've got $150 bill, $150 bill, and $100 bill, right? And we have to explain them. Well, this is this, this is that, right? So here's where you do your review, but you let them know we're bundling 3 different policies together, but it's going to be on one card and on one bill. All right. Because it's with the same carrier. So when they're able to see that you have these coverages, all right, we don't have to submit claims, to multiple carriers. And, we can submit one claim. You'll have one card, one insurance card, and it's going to be on one bill. But you are going to review it with them and let them know, hey, this is 3 policies bundled into one. All right. So you'll do a review with them. Doesn't stall out on me again. All right. Review's done. And this is where your client will put their signature. Okay. Client signature. Let them know this is not an ACA plan. Okay. And, there may be waiting periods on pre-existing conditions. Okay. But again, assume they don't have pre-existing conditions. We're selling this to healthy people. All right. You'll go to the next page. And this is where they're going to put their billing information in. Okay. And then the next is submit, and it's done. Okay. Pretty simple application process. Okay. And like I said, the effective date is pushed to 7 days out. All right. So that gives the carrier 7 days to issue the policy. and get the cards out to the client. And then, in this situation, the plan would go into effect on the 23rd. Okay. Um, that's it, guys. Pretty simple. Pretty straightforward. All right. As we go through these carriers and we go through these trainings, it's like, if you guys understand how an indemnity plan works, then it all makes sense, right? It doesn't matter if it's with MedMutual or Manhattan Life or Philadelphia American, or United Healthcare or Allstate. An indemnity plan is an indemnity plan is an indemnity plan. You really will get to the point, if you're not there already, where you can just look at a policy, see the benefit levels, and you just understand how it works, right? Um, Same thing with a major med plan, right? A major med plan is a major med plan, right? Whether it's with LifeX or Iron Health or through the marketplace. All right. You're able to look at the summary of benefits and you just understand how the coverage works. All right. So these trainings, should be a breeze for you, right? Eventually you get to a point where it's just we breeze through these things, and all you need to know is how do you run a quote, and how do you enroll them, right? So that's MedMutual. Let's see what you guys have here as far as questions go. Hema, you have MedMutual?
I didn't have. I had Aflac and what do you call Guardian last year. Last year I had Guardian. I fell and I broke my wrist, so I used that accidental. And earlier I used hospital and accidental together for my husband like 10 years ago with Aflac. So it's a
Okay, all
good
right.
cash you can use towards your deductibles.
Yeah, yeah. So you've got an idea of how that works. Yeah.
Absolutely.
So I like MedMutual, guys. I like it a lot. Like I said, for any individual that's under 50 years old, or any family that is, where the primary and spouse are, right around that middle age, 40 and under, it's going to be a very strong play. Um, so uh, anything above 50, LifeX is probably going to make more sense because MedMutual is going to catch up to them in the price. If the price is the concern above the age of 50, then Manhattan Life is the play, right? Philadelphia American is the play. So a lot of these nuances, guys, that I'm talking about right now, I don't expect you to just, I'm throwing them at you. I don't expect you to just grab them and, catch them. But I want to make sure that you guys know where you can go to get the support that you need. All right. I'm going to put Joe's information in the chat right now. All right. Joe Moranto, he's been my business partner for over 10 years. He is an absolute encyclopedia for insurance. I'm going to stick his email address in there too. Not only does he, have we been doing health insurance together for 11 years, but he's got a full portfolio of life insurance and investment products. He is also a Medicare guru. He's also a property and casualty agent. So he knows his stuff. And anything that you guys need help with on these health insurance products, Joe is available to support you. All right. So when you come across a prospect, and they've got, they're in their 40s or 50s, they've got a couple kids, their income, um, you know, disqualifies them from receiving subsidies on the marketplace, and the private plans are going to look more intriguing for them. All right. Um, and you just, hey, Joe, where do I go with this? Right. Is it only indemnity or all health insurance? What do you mean by that?
So are we talking about, like you said, he has encyclopedia only for indemnity, all insurance, or other
Oh
health
no,
insurance?
Joe's in, yeah, all health insurance across the board. Yeah. And so very soon, guys, we're going to be starting to do these trainings on the marketplace. We're going to be diving into the ACA because we're getting close now to that time of the year where the FFM certificate is going to be available for next year. So we're going to start to look at the ACA plans. Um, and we're not going to see what's available for 2027 until the last week of October, but we'll start to learn about how the ACA works and how to sell it and how to quote it and all that. But Joe's an encyclopedia of all of the above. All right, and also Medicare too. So anything that you guys need help with, you can go to Joe.
Will
All
you
right.
able to cover any new upcoming changes in the ACA or anything like that if there is any in future trainings?
Yeah, absolutely. We'll keep you guys, up to date on any new changes, Um, as it stands right now, it's pretty much operating, the same as it has in the recent years. Obviously the the subsidies, the subsidy extension is gone, right? So we're back to the original subsidy levels. Um, but that's really the only change that we've had since the new administration took office. I know, I've taken a look at what their healthcare plan is. I mean, who knows when they'll tackle that, right? I mean, they've got a whole bunch of other issues that are on their plate before they get to that. But if they decide to work on healthcare, I think they've got an uphill battle to get their plan across the finish line. That being said, if they do get their plan across the finish line, one of the things that they want to do, probably the biggest change, the most drastic change that they want to do, is they want the subsidy dollars to, instead of going to the health insurance companies, to go to the policyholders directly. All right. So if clients um, are able to get their subsidy dollars for their healthcare directly, um, excuse me, that could become very interesting, especially if they could spend those subsidy dollars on any insurance plan that they want. In other words, let's say a family of four gets a subsidy of $1,500 a month or $2,000 a month, which is a very common subsidy that we see these days, right? So a family of four gets $2,000 a month, and instead of that 2,000 going to the insurance company to pay for their health insurance on the marketplace, that 2,000 is going into an HSA account for that client, and that client is then able to use that $2,000 for out-of-pocket costs on their care or a health insurance policy of their choice. Maybe they don't have to buy the $2,000 policy on the marketplace to pay for that with that money that they're given. Maybe they could take that $2,000 subsidy and go and buy a private plan, like we're talking about. They can go and buy a LifeX plan, or they can go and buy a MedMutual plan, right? So we don't know, right? I know that's the most drastic change that they would like to implement. If they had their way in a perfect world and they got their healthcare plan across the finish line, that's what it would be. And if that happens, guys, then our business just got very, very exciting.
So that's a pretty very good step, like it's very helpful to people actually.
Oh my goodness, absolutely. Could
A
you
lot.
imagine that? I mean, if somebody got 2,000 a month,
They're
they
not
didn't have
using
to
it.
go.
It's not using it. Yeah.
Yeah, they don't have to go buy the $10,000 deductible bronze plan. Now they can go buy a LifeX plan for $1,200 a month for their family, and they have an additional $800 a month to pay for out-of-pocket costs. That would be fantastic. That would absolutely solve healthcare, wouldn't it?
Yeah, I think that's a very big change in the back end on their side. I think it will take some more time to fix all
Oh
this.
yeah. Yeah,
This
no,
big back
they've
end
got
is tough.
they've got a lot on their plate right now. They're probably not getting to healthcare this year, would be my
Yeah.
guess. So we're
Already
probably
it's
gonna,
very complicated now. It is.
yes.
It
Yeah,
is.
we're gonna go through this next year, this next open enrollment, probably, business as usual, but if they're able to make that change before the Trump administration leaves office for the second time, then that could make things very exciting in our world.
Mm-hmm. So the
So
Joe, if I have to contact Joe, do I have to mention your name or do I have to mention Phil's name?
yeah, just let him know you're with Valor. He knows.
Sure. Is he
Yep.
also expert in Medicare or no, under
Yep.
65 only?
Nope. Medicare as well.
Perfect. Thank you.
Medicare as well. So Joe can help you guys out with just about anything. Obviously, our partnership with Valor is on the health insurance side. Um, and more specifically the under 65 health insurance side. But Joe is, he's a man of the people. I mean, he's happy to help with anything that he can. So if you have questions on Medicare or group health, feel free to contact Joe. He's happy to help. All right. Any other questions, guys? No. Well,
What
I
about
appreciate.
the pre-existing? Is it the same like diabetic, blood pressure, cholesterol are considered pre-existing, or they're going to check the background medical history?
For MedMutual, it's if they answer yes to any of the
List,
um
list.
to
Okay.
any of the questions on the application, it's a kick out. As long as they answer no, they're going to issue the policy. That being said, you want to make sure with your clients that the things you're looking for um, as an agent are going to be what you just said, right? Diabetes, cancers, heart attack. If like, um, if you got um, MS, right, or rheumatoid arthritis. I mean, these are going to be things that are going to be kickouts, right? So, use your best judgment. But high blood pressure, cholesterol, acid reflux, anxiety, right? Like the regular, um, medication here and there is not going to keep them off the plan. How do you contract with MedMutual? Reach out to Phil. Shoot Phil an email. All right. Guys, I appreciate you taking the time this evening, and we will be back next week. And I'm not sure what we're training on next week, but we will let you know. All right. So reach out to Joe if you guys need anything. If you need to get contracted, reach out to Phil. And then if I'm going to go ahead and throw a link in there for me as well, if you guys want to meet with me one-on-one. This is my calendar link. So go ahead and copy that. I'll give you a minute. Copy that. That's my calendar link. You can set an appointment and we can work one-on-one together, on whatever, marketing, sales presentations. If you guys, need some more assistance with building these policies. Now, my area of expertise is going to be strictly under 65 health insurance. All right. I won't be much use to you in the Medicare space, or the life insurance space or the group health space, but under 65 health and healthcare advocacy, that's going to be my world. So if you guys could, if you need any assistance with that, let me know. And make sure you reach out to Phil to get contracted with all the carriers that we have trained on up to this point. All right. Appreciate you guys. Have a good evening and a great rest of your week.
Thank you so much for your time. It's
Thank
very
you.
Thank you. Bye bye.
Okay.